So, in today's class, we are going to discuss an important topic that is Parkinsonism. So, this is very important topic, and nowadays it's most common Parkinsonism. Okay, we'll also call PS. PS means PS positive. Some doctors will write in shortcut Parkinsonism. Okay, it is a symptom complex appears due to widespread diffuse lesions in the basal ganglia and cerebral cortex, characterized by dysarthria, alternating tremors, stupor posture, abnormal gait, cogwheel rigidity of muscle, symptoms of dysfunction of autonomic nervous system. So here it is a problem of lesion in basal ganglia. Okay, if there is a problem in the lesion occurs in basal ganglia or cerebral cortex, cerebrum. Okay, so whether in the basal ganglia or cerebral cortex. So the patient have these things. What are those? Dysarthria. What is means dysarthria? Slurred speech. Slurred of speech. Okay, and having tremors. This is the second we'll discuss it. First is slurred speech. We cannot understand the speech of the person. Okay, second is tremors. What is the third symptoms you can show? Posture. We'll see the stupor posture by the image. This is the third thing. In the fourth, abnormal gait, difficulty in walking. Okay. And the fifth one is rigidity. Rigidity means stiffness. Okay, of muscles. So these are the things you can see that. So already you know the slurred speech. Tremors means like shaking of heads, unable to anything anything they want to hold, so they will have like movement. Okay, involuntary movement. Posture, they will become like this. If they will, if you want to you want to sit like that, they will come forward. If will get- okay, and they will start talking themselves. Okay, walking difficulty, unable to walk sometimes. Sometimes they will walk but difficulty in walking, like they will like suppose they walk like this, they will fall down. Okay, rigidity. Rigidity means stiffness. The hand becomes very tight like this. And neck stiffness, starting with neck stiffness, limbs, upper limb, lower limbs, and back, lower back, upper back, everything will become very rigid. So why this happen? Because of lesion in the basal ganglia. Okay. So sometimes what is the cause? These are the clinical features. Other than that, we will discuss. It is caused by infections. Okay. What are the causes? Infection. Infection is one of the most common cause. Toxic material and as well as degeneration of the brain. Okay. And any uh, arterial damage. Okay, and mostly inflammation of basal ganglia, also lesions in basal ganglia or cerebral cortex. Okay, in this, males are suffered more than women. Okay. So let's see the basal ganglia in the image. So you can see that this is the image of the basal ganglia like this. This is a structure. Here you can see this is the basal ganglia. Okay, this is the red color. All these are basal ganglia. And this related structure, you can see that caudate nucleus, globus pallidus. You can see the image. Okay, you can see the this is your thalamus here, putamen. Okay, globus pallidus, subthalamic nucleus, amygdala. Here you have substantia nigra, ventral tegmental area. You can see nucleus accumbens, olfactory tubercle, ventral pallidum. So all these are structures, related structure of uh, basal ganglia and basal ganglia centers. Okay. So what is the basal ganglia function? It is very important. You can see that. What is the function? Basal ganglia. You can see here they have the control of muscle tone, control of motor activity, control of reflex muscular activity, control of role in arousal mechanism, role of neurotransmitters in the function of basal ganglia. So mostly muscle controlling power is present in the basal ganglia. Okay. Most of this basal ganglia function is to control the muscle. So if there is damage in the mostly motor control, okay, and decision making, okay, any type of addiction will happen. It will affect the basal ganglia itself and learning. These are the major functions of basal ganglia. Other than that, motor control is very important. So motor control is not happening properly. So that's the reason the patient have rigidity and uh, patient have tremors, okay, difficulty in walking. Okay, all these are the sign of basal ganglia. So this is about basal ganglia function and other things. Let's see the clinical features. How this will start. It is onset is insidious with general feeling of stiffness, while diffuse muscular pain, tremors of extremities. So start with weakness. Neurological diseases all will start with weakness itself. Okay, start with weakness, then gradually it will start stiffness of extremities. Okay, and what will happen? General expression are mask-like appearance of face, infrequent freckling of eyes, like some general things you have to observe. The patient will start doing like that, like blinking of eyes, staring eyes like that. Mouth is slightly open always, like this. Okay, and saliva is coming. Speech is low. So all these general things will become very freckling type. Body movements are restricted. So patient having stiffness, difficulty in movement, okay, slowness of mastication, difficulty in chewing the food, and swallowing, difficulty in swallowing is also there because of muscles. Weakness of muscles, basal ganglia controls the muscle. So there's the reason the stiffness of muscles is present in all over the body, even the swallowing muscles also, esophagus. Okay, rigidity present. Okay, gait is difficult. Okay, means difficulty in walking, standing difficulty, walking difficulty is seen, and patient having tremors. If you give the any small thing also, it will like shake the hand. Okay, and the stemmer start with upper limbs and they will go to the lower limbs. Okay, so these are the things you have to observe in the clinical features, starting with the weakness, stiffness of extremities. The general expressions will change, like blinking of eyes, opening mouth, the staring the person. Okay, and speech becomes very slow gradually. Okay, all these things, and the patient starts the stiffness from the upper limb going to lower limb, all over the body, difficulty in swallowing. All these are seen in Parkinsonism. Parkinsonism. You have to differentiate with other things also. Okay, mostly how can you diagnose this? These are the diagnosis with the clinical symptoms itself. Okay, these symptoms will leads to you to the Parkinsonism. Okay, so they will start uh, the neurotransmitting drugs. Okay, so in the allopathy, to control neurotransmitter is decreased in this person, so they will increase the neurotransmitter. uh, so the connection between the muscles and nerves will increase, so gradually the patient will having the neurotransmitter, the patient will gradually recover. So the stiffness, if the is increasing, if it is increases, so the stiffness will need sometimes exercise, physiotherapy, like that stuff they will advise to do the patient. Okay, so it is depend upon the condition of the patient to treat the disease. Okay, in which stage they will come. In our electrohomeopathy, what we can do? We can have the treatment in electrohomeopathy, but again, this is a chronic disease. Patient needs some time uh, to get the result. Then only the patient will improve. So we have in electrohomeopathy, we have to treat the patient with this type of treatment. So let's discuss the treatment part. So basically, we have neuro or degeneration. If it is purely depend upon the cause, so mostly the cause is lesion. So we focus on the lesion and infection and toxins. There is another cause is degeneration. All these four causes they be there. So we will focus on lesion. Okay, you have to go through with basic remedy, that is S1 A1 WE, and second F1 R1 Y. F1 R1 Y. This is very important remedies to the patient. You have to start with D5 itself, and the second is S10 A3 RE. This is also very important to increase the metabolism in the brain. And along with, you have to give the application, that is F2WE, because PNS also involved. So that's the reason we are giving peripheral nervous system. So F2WE. So WE will work on entire nervous system. Along with F2, you have to give WE also. So here, after some, here you are giving RE also. It will increase the metabolism and nutritive metabolism to the all over the body. S10 A3 RE. Very good combination. This is to increase the metabolism, to increase the metabolic rate in all over the body. We can give the S10 A3 RE. Okay. So this is the treatment for Parkinsonism, but is a degenerative disease. Okay. So the patient will, if any emotional issues, if any triggers will occur, so it will reoccurrence will happen. Okay. So we have to uh, not only give the treatment as well as emotional balancing to the patient. It is very important. Okay. So emotional balancing will give the patient a lot of confidence. Okay, that will not only treat the disease as well as his body also. Okay, his body also will improve. So along with the treatment, emotional balance is very very important to the neurological disease patients. Whoever neurologically affected, so you need emotional support. So you need to tell the patient attenders, not only you have to treat the patient with medicine, you have to support whole family support needed to the neurological patients. So this is all about the Parkinsonism. Okay. So this is the treatment part. Okay. If any doubts, you can ask.